Hello and welcome to my YouTube channel. Today I'll be speaking to you about a condition called oral thrush, the other name being oral candidiasis. Candidiasis simply is a fungal infection occurring in the mouth. So oral in medicine means mouth, and thrush is candidiasis. So you could also say mouth thrush or oral candidiasis. So essentially, who does this affect? Who does this fungal infection affect? Babies, older people with dentures, patients that are immunocompromised, for example, patients that have HIV, patients that use steroid inhalers for asthma, those with diabetes, those that have used chemotherapy for cancer treatment, and those that have been on antibiotics for prolonged use. But what exactly do you find as the underlying phenomenon here? Basically, when there is weak immunity, when the system is weak or the immune system is compromised, you would have difficulty with counteracting or fighting or warding off these fungal infections, and so you're predisposed to having oral thrush. Essentially, if you look into the mouth of a patient that has oral thrush, you will see that the mouth is red with white patches. And if you try to scrape these white patches, you will notice some slight bleeding. Also, you notice that they could have cracks at the corners of the mouth. They could have an unpleasant taste in the mouth. They could also have difficulty with eating and drinking. What do you do in terms of treatment? The doctor will prescribe an antifungal medication. This usually will resolve easily. However, it's important to mention that prevention could be the key here. And what do you do in terms of prevention? Oral hygiene. You need to be able to brush twice daily. And if you have dentures, it's important that you keep up with your dental appointments. It's important that those that use steroid inhalers rinse their mouth after use. Rinse and spit out after use. And if you have diabetes, it's important that your diabetes is adequately controlled. It's also important to mention that since oral thrush could be one of the findings or one of the features of retroviral disease. Retroviral disease simply means having HIV. Therefore, in addition to treating the the oral thrush, patients would need to be on medications for for HIV. So it's not simply just treating the oral thrush. If you do that without treating HIV, then there's a chance that there will be recurrence. So in summary, oral candidiasis simply means fungal infection affecting the mouth and possibly will occur in a patient that has a weakened immunity or that is immunocompromised. And treatment is use of antifungal medication. Prevention is key, which is oral hygiene and rinsing the mouth if you do use inhalers or steroid inhalers, I should say. Thank you very much and hope to see you again. Bye.